Hello, my name is Lisa Ye, and today I will be doing the oxygen administering skill video. I have here my mannequin. We have some gauze here, the nasal cannula, and we have the non-rebreather mask. All right, let's go ahead and get started. I'm going to go ahead and knock on the door, enter the room, and then close the door and curtains behind me. Start with hand hygiene, and then I will introduce myself to the patient. Hi, sir. My name is Lisa, and I am your nurse today. Can I get you to verify your full name and your date of birth? Patient will go ahead and verify full name, date of birth. We will check the wristband for 2 patient identifier. All right, sir. It looks like your oxygen is low today. Your provider ordered for us to apply oxygen for you. Is that okay? Patient gives a consent. So let's go ahead and get started. I have the nasal cannula here. We'll take this out of the package. And then we'll check the flow meter on the wall. It should be green, and it should verify oxygen. We'll plug this in, and then we'll connect this to the nose and then loop it around the ear. We'll clench this for comfort. And then usually for a nasal cannula, it should be 1 to 4 liter, depending on the physician's order. Anything over 4 liter, we will need to use a humidification. That's to prevent dryness of the nasal passage. All right, and then we'll place patient in a comfortable position. I will go ahead and use gauze here. We'll put it on the ear. So this is to help any discomfort or any skin breakdown. So we'll put this on your ear, cheeks. Same thing on this other end. I want you to make sure to breathe in through your nose and out through your mouth, and then I will check back in about 2 hours for any skin breakdown of your skin. We'll monitor you. Do you have any questions for me? Patient don't. I will leave the call out within reach here. If you have any questions, please let me know. If you have any shortness of breath or anything, please let me know. So I'll go ahead and go and document. And then once I come back, I'll go ahead and knock on the door, check on the patient, knock on the door, close the door behind me, close the curtains, start with hand hygiene. All right, Mr. Smith, so it looks like your oxygen is still running a little low. The doctor ordered for us to use a rebreathing mask. So we'll use that. That is to help you breathe a little bit, have somewhere a little bit of oxygen. So let's go ahead and remove these. And then we'll go ahead and disconnect the cord from the wall, the flow meter, and take these off. We'll go ahead and discard these into the trash. And then we will grab our non-rebreather mask. Right. So we will go ahead and connect this. Same thing, we're going to verify if it's green and then it says oxygen, and then we'll plug this in. For non-rebreathing mask, it is about 10 to 15 liters, depending on as ordered by the provider. In this case, we will be using 8. Okay. So I will put this on the patient. So we'll go ahead, make sure. We'll clench the strap for tightness or comfort, and clench the nose. Make sure it's comfortable. And then we'll use gauze here on the ear to prevent any skin breakdown or discomfort. And same thing on this side. All right, Mr. Smith. So we'll put these on. This should help you breathe a little bit better. I will come back to check you in 2 hours for any skin breakdown. And then I will put the green, the call light within reach. If you have any increased shortness of breath, please let me know, or any discomfort, please feel free to let me know so I can come back to assist you. Do you have any questions for me? Patient don't have any questions, so I'll go ahead and go document, place patient in a comfortable position, go document. And then once the therapy is, we are done with the therapy, completed, I will come back and knock on the patient's door, enter the room, close the door, and then the curtains behind me. I will go ahead and start with hand hygiene again. All right, Mr. Smith, so it looks like we are done with the therapy, and your doctor ordered for us to remove the mask. So let's go ahead and do that. We'll remove the gauze, and then we'll remove the mask. And then we'll go ahead and disconnect this from the flow meter. Discard everything into the trash. Go ahead and start with hand hygiene. All right, I will place the patient in a comfortable position. All right, Mr. Smith, do you have any questions for me? Patient don't have any questions. Put them in a comfortable position, and then I will go and document.